abstinence is always going to be the number one prevention of this. But let's go ahead. We know the way that society works now. We hope and pray that our kids will not do this. But if they do, let's make sure that they're safe when they're doing it. It'll educate the adolescents, give them a safe place to go if needed, and also will help reduce STIs and teen pregnancies in their population. Now, a lot of you may think about costs associated with this. Costs associated with the policy will be lower than expected, as it will be mandatory elective that will come out of the elective money. The only additional cost will be hiring of several teachers, expertly give education on the topic, maintain control of the class, and answer difficult questions. Also, there will be small costs of office fees associated with the teen clinic and an NP or RN, a lab tech, to see that the patient has all the clinic needs provided to them. Lastly, purchase a cell phone that can be used for the teen clinic hotline. The benefits of educating teens, preventing unnecessary teen pregnancies and unwanted teen STIs. This will not only benefit us in the short term, but also in the long term, as our community's health will get stronger with downgrading of numbers of teens with early pregnancies and STIs. There can be many risks associated with this enacting the policy, or outrage by the public, by your fellow legislators, the type of education and making it mandatory. Why should my child go into this class? Why should my child do this? And why should it be mandatory? Those are all great questions. But the best answer is your child's not going to get a disease or an infection. Your child is not going to have to grow up in poverty due to having an early pregnancy, a teen pregnancy. They're not going to have to face abortion or adoption because they weren't ready to be a parent. All of these things they're not going to have to face just by getting a simple educational class. And they're going to have access to health care for the first time by themselves without having to have insurance or anything else. They're going to get seen and taken care of because that's what we need to do as public health in our community and our community's health's sake. Those that are already with an STI can get treatment and learn about prevention techniques. And if it is HIV, they can be sourced out to the proper state agency to be taken care of and live a long and healthy, normal life. This will also give them sources of health care through state agencies in all ways, from the conception, birth, and early pediatrics up to the age of 4. This educational policy will not only help to treat STIs and prevent them, it'll help pregnant teens improve community, help those pregnant teens get out and find out what there is in their community and how to get those resources available to them, how to get pregnancy Medicaid, how to do the things that they need to do to be better mothers. It'll improve our community health. It'll educate unaffected teens and affected teens, open a new care line and a clinic for teens, and reduce abortions. In conclusion, we can see not only those that would be affected by the policy change, we can also see those that benefits due to the policy change. The benefits of those affected and those not affected, reducing health care and state costs and educating our youth on the dangers of unprotected and unsafe sex, STIs, and teen pregnancy. We can also see that this policy will help to keep our community healthy for years to come and also decrease the number of teens in poverty and STIs and pregnancy when it's not needed. It's fine if you want to have a kid. Just know that you got to have a plan and a way to take care of them. We want to prevent them having it before they're ready. Lastly, this policy will continue to help educate and see teens in a safe manner while keeping their health care at the utmost importance. I just want to say, I know a lot of you may think that this is wrong or this is right. I'm not here to judge you whether you think it's right or wrong. I just want you to see this as a policy that needs to be enacted to help make our teens safer, help them give an extra avenue for education and health care, as well as learning about their bodies, learning the safe way to do things as an adult would do them, and preventing those STIs. That's our main goal. Let's prevent the STIs. Let's prevent these early teen pregnancies when they're not wanted. And let's do it the right way, by giving our kids education and access to care, and doing everything else we can do for them to help our future in our community. Thank you. God bless.